Pomona Valley Hospital Medical Center presents a Medical Minute on atrial fibrillation with Dr. Ramanna Merla.
Atrial fibrillation is an abnormal rhythm of the heart. They have palpitations. That means they feel the heart is racing. They feel fullness in the neck, and they start feeling very fatigued. When they walk a few steps, sometimes they get short of breath, or they're not able to function. The treatment options for atrial fibrillation is divided into two. One is something called the rate control. The other one is the rhythm control. The rate control is what we do for majority of the patients, where we leave them in atrial fibrillation. We don't try to correct the rhythm. We just prevent them from going fast by giving medication to slow the heart. And there's the other group where the rhythm control is when they fail this rate control, then we go to rhythm control. And the rhythm control can again be divided into two parts. The first one is giving them something called antiarrhythmic medications to put them back into normal rhythm and try to keep them in normal rhythm. And if still they don't respond to this, or they don't want to be on antiarrhythmic medications for life, then we go to something called ablation. We take catheters from the groin, from the femoral veins. We thread them up towards the heart. We make a small hole to the left side of the heart, and we burn around the pulmonary veins. These veins are thought to be the triggers for atrial fibrillation. So we can either use heat, which we call radiofrequency ablation, or we can use cold, which we call cryoablation, to separate the veins from the atrium itself.